Should I be worried about an abnormal pap smear result? Getting an abnormal pap smear can feel unsettling, but it's important to understand what it really means. A pap smear is a screening test that checks cervical cells for irregularities that might develop into cancer. When the result is abnormal, it doesn't mean you have cancer, but it does mean some cells look different from normal and need further evaluation. Most abnormal results are caused by infections, especially human papillomavirus, or HPV, which is very common and usually clears on its own without causing harm. Only a small percentage of abnormal pap smears indicate precancerous changes or cancer. Early detection through follow-up tests can help catch any issues early when they are most treatable. The most common abnormal findings include different categories. For example, ask us, which stands for atypical squamous cells of undetermined significance, is the most frequent result and often relates to infections or irritation. Usually, an HPV test is done next to see if the virus is involved. LSIL, or low-grade squamous intraepithelial lesion, indicates mild abnormalities often caused by HPV that tend to resolve naturally. HSIL, or high-grade lesions, are more serious and have a higher chance of progressing to cancer if not treated. Other results like AskH, which raises concern for more serious changes, or atypical glandular cells, which might suggest precancer or cancer in the cervix or uterus, requiring careful follow-up. It's important to remember that most abnormal pap smears are linked to HPV, which is widespread and often harmless. Infections from bacteria, yeast, or other organisms, as well as inflammation or hormonal changes, can also cause abnormal results. Sometimes, testing conditions or temporary factors can lead to false positives. If your pap smear is abnormal, your healthcare provider will recommend next steps. These might include repeating the pap test or doing HPV testing to monitor changes over time. A procedure called colposcopy might be suggested, where a special magnifying device is used to examine your cervix closely and take small tissue samples if needed. If precancerous changes are found, treatments are available that can remove abnormal cells before they develop into cancer. It's natural to feel worried, but remember that early detection and proper follow-up greatly reduce the risk of developing cervical cancer. Avoiding vaginal douching or using vaginal products before testing can help improve accuracy. Staying up to date with regular screenings as recommended by your healthcare provider is key. In summary, an abnormal pap smear doesn't automatically mean you have cancer. It's a sign that your healthcare team needs to check further to ensure everything is okay. Most abnormalities are treatable or resolve on their own, especially when caught early. Always discuss your specific results and next steps with your healthcare provider, who can give you personalized advice based on your health history and risk factors.